Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please take a seat. How can I help you today?
Good morning, doctor. I've been experiencing some troubling symptoms, and I'm really getting concerned. I first noticed this dull, aching pain in my shoulders and neck 2 months back. At first, I thought it might be just from bad posture or stress, but the pain's been getting worse. Now, it's spread down to my hips and thighs, and I'm finding it really hard to move around. Even simple tasks like brushing my hair or getting dressed take me forever. It's frustrating, to say the least. The stiffness is the worst in the morning. Sometimes, I can barely get out of bed.
That does sound difficult, Mihiraa.
Yes, I have. I've also been feeling exhausted all the time. I used to be quite active, but now, even walking for a few minutes leaves me tired. And it's not just fatigue. I feel this general sense of malaise, like I'm always coming down with something. I've had low-grade fevers, especially in the evenings, and I've even noticed some weight loss, although I haven't been trying to lose weight. My appetite has been off as well. I don't feel like eating much these days. The pain is also affecting my sleep. It's hard to find a comfortable position, and I wake up a lot during the night. I've been feeling quite down because of all this. I'm worried that something serious might be going on.
I can understand your concern, Mihiraa. Have you tried any treatments or remedies to alleviate the symptoms?
Yes, I've tried a few things. Initially, I thought maybe I just needed rest, so I took it easy for a week, but that didn't help. Then I tried some over-the-counter painkillers like ibuprofen, but they didn't do much either. I finally went to the pharmacy, and they suggested I try naproxen, but that only gave me temporary relief. The pain would ease a little, but it always came back. I even tried some herbal remedies like turmeric tea, thinking they might reduce inflammation, but I didn't notice any improvement. I've been trying to avoid stronger medications because I don't want to rely on them, but at this point, I'm willing to try anything. I also used a heating pad on my shoulders and hips, which helped a bit with the stiffness, but again, it's only temporary.
I see. Have you been on any long-term medications for other conditions?
Yes, I have a bit of a history of hypertension, so I've been taking amlodipine for about 3 years now. Besides that, I've been on a low-dose aspirin for heart health, which my previous doctor recommended, especially with my family history of cardiovascular problems.
Speaking of family history, is there anything else relevant we should know? Any history of similar symptoms in your family, Mihiraa?
Well, both my parents had some chronic conditions. My mother had rheumatoid arthritis and my father had heart disease. I remember my mother used to complain about joint pain, especially as she got older. But the symptoms seem a bit different from what I remember her describing.
It's good that you mentioned your family history. Based on what you've described, I'm leaning toward a diagnosis of polymyalgia rheumatica, an inflammatory condition that causes muscle pain and stiffness. The fact that the pain is worse in the morning and improves somewhat as the day goes on is another characteristic.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mihiraa. I'm Dr. Alfred Chris, a pulmonologist. What brings you in today?
Good morning, doctor. I've been having some trouble breathing for the past few days, and it's getting worse. I feel like I can't take a full breath. Sometimes I get these sharp pains in my chest, especially when I try to breathe deeply or move around.
I see. That sounds concerning, Mihiraa. Can you tell me more about the symptoms?
It started about a week ago, maybe more. At first, it was just mild discomfort, but now it feels like I'm gasping for air sometimes, and the pain is almost constant. It's particularly bad when I lie down. I've also been feeling more tired than usual. I have no fever, but there's some coughing, although it's not frequent or severe. I thought it might just be a cold at first, but when my breathing didn't improve, I started to worry.
Have you tried any treatments or medications to relieve these symptoms?
Yes, I initially took some over-the-counter painkillers to manage the pain. They helped a little, but the relief didn't last long. I also tried using an inhaler that my GP prescribed a few months ago for mild asthma symptoms, but it hasn't made any difference this time. I even tried steam inhalation at home, thinking it might help with the chest tightness, but nothing seems to work.
I see. So, you've had some asthma issues in the past. Can you tell me a bit more about your medical history, Mihiraa?
Well, I was diagnosed with mild asthma about a year ago, but it's usually pretty well controlled. I only get shortness of breath occasionally, like when I'm exercising or during cold weather. Aside from that, I've had no major health issues. I've never had anything like this before.
Thank you for sharing that. Based on what you've described, I'd like to investigate further. Your symptoms can point to a few conditions. One possibility that I'm concerned about is a pneumothorax.
That sounds serious. What causes that?
It's when air leaks into the space between the lung and chest wall, putting pressure on the lung and making it difficult to expand fully. This could explain your symptoms.
Oh my. Is it dangerous?
It can be serious, but with the right treatment, most cases are manageable. To confirm this diagnosis, I'll need to order some tests. I'd like to start with a chest X-ray, which should give us a clear image of your lungs. In some cases, we might also do a CT scan to get a more detailed look if necessary.
Okay, I understand. How is it treated?
Treatment depends on the severity. Mihiraa, for a small case, sometimes the air can be reabsorbed by the body on its own, and we can manage it with oxygen therapy. But in more significant cases, we might need to remove the air manually. It's a simple procedure, but it must be done carefully. This can be done by inserting a chest tube into the chest to relieve the pressure and allow the lung to re-expand.
That sounds scary. What about medication? Will I need any medication for this? We'll provide Motrin for pain if necessary. You may not need specific medication unless there's an infection, and if there's any concern about infection, we might prescribe cephalosporins. However, the primary focus is on removing the air and allowing the lungs to re-expand naturally.
I appreciate the explanation, doctor.
You're welcome, Mihiraa. That is the end of Part A. Now look at Part B.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a surgeon called Mihiraa talking to a patient. Now read the question.
Mr. George, I'm pleased to inform you that your surgery was a success. The tumor was removed completely, and there were no complications.
That's excellent news, Dr. Mihiraa. I'm relieved to hear that.
Now, let's discuss your recovery. You'll need to stay in the hospital for a few days for observation. We'll monitor your vital signs and ensure you're healing properly.
How long will it take to recover fully?
Recovery time varies depending on individual factors. It may take several weeks for your incision to heal completely. You'll also need to follow post-operative instructions carefully to prevent complications.
Are there any restrictions I should follow, Dr. Mihiraa?
George, you'll need to avoid strenuous activity and heavy lifting for a few weeks. You should also follow a healthy diet and stay hydrated.
I'll do my best to follow your instructions. Now look at question 26. You hear a physiotherapist called Mihiraa discussing with a patient. Now read the question.
So, Roger, you mentioned that your right knee has been bothering you. Is that the one you injured playing football last year?
Mihiraa, the right knee's pain started after I twisted it last month. It's the left knee that's been an issue since that football injury. I still feel stiffness sometimes, especially when I run, but the sharp pain in the right knee is the new problem.
I see. So, the right knee is recent, and the left knee is more about ongoing stiffness. Do you also have any discomfort in your lower back? I remember you mentioning it a few sessions ago.
Yes, Mihiraa, the lower back pain comes and goes, usually when I stand for long periods. But my main concern is this knee situation. The right one hurts when I bend it, and the left one just feels stiff. I don't know if they're connected.
It's unlikely that the knee issues are linked to your lower back directly. However, the right knee's pain could be due to compensating for the left knee's stiffness. We'll need to address both knees, but focus on reducing the inflammation in the right knee first.
Now look at question 27. You hear the head nurse called Mihiraa conducting a morning meeting. Now read the question.
All right, team, let's go over today's priorities. First, Mrs. Norris in room 401 is still experiencing dizziness. We'll monitor her blood pressure every 2 hours, but if it drops below 90/60 again, we may need to escalate. John, you'll be handling her today.
Got it. And Mihiraa, what about Mr. Randy in 405? He had a fever overnight.
Yes, his temperature spiked to 39 degrees Celsius around 2 a.m. You'll continue with his antibiotic course, and we'll check his vitals every 4 hours. If the fever doesn't subside by noon, we'll consult with Dr. David. Also, don't forget Mrs. Lewis in 402. Her glucose levels have been erratic. Check her every 3 hours, but the priority is managing Mr. Randy's fever.
Mihiraa, should I assist John with Mrs. Lewis if needed?
Yes, Sarah, but only after completing your rounds in the ICU. They've been short-staffed this morning, and you need to cover for Stain. ICU first, then help with Mrs. Lewis if required. Make sure to update me on anything urgent.
Now look at question 28. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Dr. Daniel, I've been monitoring Mr. Max in room 406. His vitals have stabilized, but his breathing is still shallow. I know we increased his oxygen support yesterday, but I'm wondering if we should consider a change in his medication. He's been on the current regimen for over a week.
I agree, Mihiraa, his oxygen saturation has improved, but shallow breathing is concerning. I was actually considering adjusting his dosage. Did his chest X-ray show any fluid accumulation?
No, the X-ray was clear, and there are no signs of infection either. His heart rate is steady, but I've noticed some swelling in his legs, which wasn't there before. Could it be related to the medication?
Possibly, but without fluid in the lungs, it's less likely to be a direct result of the oxygen treatment. Let's reduce his diuretics slightly and see if that helps with the swelling. Mihiraa, keep monitoring his breathing closely.
So we'll keep the oxygen level stable and adjust the diuretics. I'll update his chart and keep an eye on the swelling.
Now look at question 29. You hear a surgeon called Mihiraa talking to a GP. Now read the question.
Dr. Philip, I wanted to discuss Mr. David's post-op recovery with you. He had his gallbladder removed last week, but his abdominal pain hasn't fully subsided. I'm concerned because, although the surgery went smoothly, the pain should have decreased by now.
Mihiraa, I saw him yesterday. He mentioned some mild nausea, but the pain seemed more localized near the incision. Have you ruled out any infection or hernia complications?
Yes, we did an ultrasound yesterday, and everything looked normal. No fluid buildup, no signs of infection. I also checked his blood work, and his white cell count is within the normal range. The nausea could be from the pain medication, but I'm more worried about the persistent discomfort.
That makes sense. Do you think it could be related to his pre-existing digestive issues? He did have occasional bloating before the surgery.
It's possible, but his symptoms don't quite align. I'm thinking of tapering his pain meds to see if that helps. But I wanted your input, maybe an additional GI consult?
Mihiraa, I agree with tapering the meds and think a consult would be wise, especially since his digestive history might complicate things.
Now look at question 30. You hear a physician called Mihiraa talking to an orthopedic consultant. Now read the question.
Dr. Hans, I've been looking into using the dynamic compression plate for Mr. Noble's femur fracture. He's been non-weight-bearing for 6 weeks, but his X-rays still show delayed healing. I'm wondering if the external fixator should be replaced with the plate for better stability.
I see your point, Mihiraa. The dynamic compression plate is useful for stabilizing long bone fractures, especially when there's a lack of proper healing. But have you considered continuing with the external fixator for a bit longer? Sometimes, switching too soon might disrupt the little healing that started.
True, but I'm concerned that prolonged use of the external fixator is contributing to muscle wasting in his leg. He's already showing signs of atrophy. Wouldn't the plate allow for more controlled mobilization and prevent further loss of muscle mass?
It could, but the plate has its risks too, particularly if the bone isn't ready for that level of stress. Mihiraa, we should check his bone density and maybe start with partial weight-bearing exercises before considering a switch. The plate would allow for better alignment, but I'd prefer caution with a phased approach. Agreed, let's reassess after the bone density scan, but keep the plate as an option if things don't improve.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a dentist, Dr. Mihiraa, and an interviewer.
Thank you, Dr. Mihiraa, for joining us today. It's great to have you. Let's begin with a more personal question. How do you feel about being a dentist? Is it something that you always wanted to do?
Thank you for having me. Dentistry, for me, has always been about more than just treating teeth. It's about understanding the intricate connection between oral health and overall well-being. I didn't always know I would become a dentist, though. In fact, during my early years, I had considered several medical fields. What drew me to dentistry was the blend of precision, patient interaction, and the ability to solve immediate problems. There's something fulfilling about seeing a direct result from your work, whether it's alleviating pain or improving someone's smile. And with children, particularly, there's this added layer of helping shape lifelong health habits. It's rewarding, but certainly comes with its unique set of challenges, especially since kids can often feel more apprehensive than adults.
That sounds like a fulfilling but tough balance to strike, especially with young patients. Could you tell us about the most difficult case you've attended, Dr. Mihiraa? How did it test your abilities?
There are difficult cases, and then there are those that really stay with you. One that I often reflect on involved a 6-year-old girl who had extreme dental anxiety and severe tooth decay. What made the case challenging wasn't just the medical aspect, though, believe me, managing extensive decay in such a small child is complex, but the psychological one. The fear was palpable. She had had a traumatic experience with another dentist, and every small action I took triggered a strong emotional reaction. The dental problem was bad enough, but earning her trust was my real challenge. I had to develop an entirely different approach, working with her over several visits to desensitize her to the environment. Over time, through various distraction techniques, storytelling, and even involving her in small decisions like choosing tools or flavored pastes, we slowly progressed. It wasn't a quick solution, but eventually, we completed her treatment. It taught me that the most difficult cases aren't always about the complexity of the dental procedure itself, but about understanding the patient holistically, especially when they're young.
That's truly remarkable, Dr. Mihiraa. It seems like you apply specific methods tailored to each patient's needs. Can you share some of the techniques you use with children and how you adapt them depending on the child?
Absolutely. Every child is different, and there is no one-size-fits-all approach. When it comes to children, patience is key. I always start with something we call the tell-show-do technique. It's as simple as it sounds, but highly effective. I begin by explaining what I'm about to do in very child-friendly terms, then show them the instrument or action before actually doing it. This removes the element of surprise and helps build their confidence. For some children, distraction techniques work wonders. I often have playful conversations, engaging them in discussions about their favorite TV shows or hobbies while I work. For those with heightened anxiety, Introducing sedation dentistry, whether it's nitrous oxide or conscious sedation, can make the experience more manageable for them. And then there's positive reinforcement, which involves rewarding children for their bravery or cooperation. It's not always a tangible reward. Sometimes it's just praise, but it reinforces a positive memory of the dentist, which is critical. My goal is to ensure they feel empowered rather than scared.
It sounds like you've crafted quite an adaptable approach. How did you become so established in the field? Dr. Mihiraa, what has your journey been like?
My journey wasn't a straight line. After completing my formal education, I realized that to be truly successful in pediatric dentistry, I had to blend clinical expertise with softer skills like communication and emotional intelligence. It was essential to not just know the dental procedures, but also to understand child psychology. I spent several years working under experienced mentors who specialized in pediatric dentistry, and that shaped my approach. But beyond learning from others, I continuously invested in myself. I attended workshops, studied new techniques, and stayed updated with advancements in dental technology. Over time, I also built trust with families. Word of mouth plays a significant role in building a pediatric practice. Parents need to feel assured that their child is in good hands, and once that trust is established, it spreads. It's not just about fixing a tooth, it's about creating a positive and long-lasting relationship.
Speaking of building trust, some cases must be extremely critical. Can you give an example of how a situation might become critical and what factors make it so?
Definitely. In dentistry, particularly with children, things can escalate quickly if not addressed early. One case that comes to mind involved a young boy who had an undiagnosed dental abscess. His parents had dismissed the swelling as a minor issue, but by the time they brought him in, the infection had spread significantly. If left untreated, dental infections can spread to other parts of the body, including vital areas like the brain, leading to life-threatening conditions. The challenge here wasn't just treating the infection, but managing the pain, the child's fear, and explaining the gravity of the situation to the parents without alarming them too much. In these cases, quick decision-making is crucial, and often, collaboration with other medical professionals is necessary. Dental problems, especially those involving infections, can quickly become systemic, so immediate action is vital.
That's an eye-opener. Lastly, Dr. Mihiraa, could you touch upon the technological advancements in pediatric dentistry? How do they impact your practice?
Technology has certainly revolutionized dentistry, especially in pediatric care. One of the biggest advancements has been in diagnostic tools. Digital radiography, for instance, allows for faster and safer imaging with lower radiation exposure, which is crucial for children. Laser dentistry is another breakthrough that's making treatments more comfortable. Lasers can be used for a range of procedures, from cavity removal to soft tissue surgeries, often with minimal pain and faster recovery times. Sedation and anesthesia have also seen advancements, making the experience far less traumatic for children who need more intensive procedures. Additionally, the rise of 3D imaging and printing is transforming how we approach complex cases like orthodontics or reconstructive surgery. In many ways, technology allows us to deliver precise, less invasive, and more efficient treatments, all while keeping the child's comfort at the forefront.
Now look at Extract 2. Questions 37 to 42. You hear a pharmacist, Noel Rome, talking about his role in Mihiraa Multispeciality Hospital. You now have 90 seconds to read questions 37 to 42.
Good day, everyone. My name is Noel Rome, and I have the privilege of serving as a pharmacist at Mihiraa Multi-Speciality Hospital. I am here today to talk about the critical role I play within the hospital, as well as the broader context of the pharmacy department's contributions to healthcare. As a professional within this dynamic institution, I ensure that the intricate network of medication management and patient care functions efficiently and seamlessly. Today, I will walk you through various facets of my role, the importance of my department, and how we work closely with a multidisciplinary team to enhance the overall quality of care at Mihiraa Multi-Speciality Hospital. I work in the pharmacy department at Mihiraa Multi-Speciality Hospital. The pharmacy department is a critical component in the hospital's ecosystem, responsible for managing and dispensing medications, offering drug-related consultations, and ensuring compliance with safety protocols. Our department functions as the key intermediary between medical practitioners and patients in terms of safe medication use. While it may seem like we only dispense prescriptions, our actual responsibilities are far-reaching. We also develop individualized treatment plans by assessing drug interactions, educating patients about their medications, and working with other departments to ensure medications are available when and where they are needed. At Mihiraa Multi-Speciality Hospital, we don't just handle medicines, we handle lives. The rigorous protocols we follow ensure that each patient receives the right medication at the right time and in the correct dosage. Our department also contributes to research and clinical trials by monitoring the efficacy of new drugs and maintaining up-to-date knowledge about the latest in pharmacological advancements. As a pharmacist at Mihiraa Multi-Speciality Hospital, my role extends beyond dispensing medications. I am deeply involved in several layers of patient care. One significant part of my job is medication therapy management, where I review each patient's medication regimen to optimize therapeutic outcomes. I engage in direct patient counseling, offering advice on potential side effects, drug interactions, and the best practices for adherence to prescriptions. Additionally, I collaborate closely with doctors and nurses to recommend the safest and most effective drug therapies. By working alongside the clinical staff, I can offer pharmacological expertise that enhances the decision-making process. Beyond patient-facing responsibilities, I am responsible for inventory control and maintaining a balance between drug availability and budgetary constraints, ensuring that Mihiraa Multi-Speciality Hospital operates efficiently without compromising patient care. The pharmacist's role at Mihiraa Multi-Speciality Hospital is indispensable. Medications are central to patient treatment, and any error can have serious, sometimes fatal, consequences. This is where my role becomes crucial. I ensure accuracy in drug dispensing, review prescriptions for potential conflicts, and provide essential information to both healthcare providers and patients. Pharmacists are often the last line of defense before medication reaches a patient. Miscalculations or overlooking a possible interaction can lead to life-threatening situations, which emphasizes the weight of our responsibility. Given the complexity of modern pharmacotherapy, my role is increasingly vital in managing chronic conditions and infections, and in the postoperative recovery phase. With Mihiraa Multi-Speciality Hospital being a center of excellence in various specialties, my role becomes even more critical in supporting the hospital's reputation for quality care. Mihiraa Multi-Speciality Hospital operates on a multidisciplinary care model, which means collaboration is key. In my role, I regularly collaborate with various healthcare professionals, including physicians, nurses, dietitians, and even social workers. This collaboration ensures that patients receive holistic, well-rounded care. For example, in cases where a patient is on multiple medications, I work closely with doctors to avoid polypharmacy complications, adjusting dosages as needed and advising on alternatives if a drug interaction is detected. During rounds, I join the medical team to provide input on the pharmacological aspect of the treatment plan. My recommendations often revolve around dosage adjustments based on the patient's condition or offering less invasive, drug-based interventions. The ability to communicate and coordinate effectively with other departments is integral to the smooth functioning of Mihiraa Multi-Speciality Hospital, as the speed and accuracy of our interventions often determine patient outcomes. While the primary reward is knowing that the patients are receiving the best care possible, recognition for a pharmacist's contribution at Mihiraa Multi-Speciality Hospital is far from overlooked. The leadership here places significant emphasis on acknowledging the behind-the-scenes efforts that go into ensuring patient safety and drug efficacy. My work is often appreciated during interdisciplinary team meetings, where the value of precise medication management is celebrated, especially when complex cases are resolved successfully. Moreover, we receive constant feedback from patients who appreciate the time we take to counsel them about their medications. It's fulfilling when patients return for follow-up consultations, expressing gratitude for the guidance that improved their quality of life. Internal recognitions, like employee awards and commendations from department heads, further reinforce the essential role that pharmacists play in this multidisciplinary framework. For those considering a career in pharmacy, my advice would be to never underestimate the complexity of this field. Working at Mihiraa Multi-Speciality Hospital requires not only a sound understanding of pharmacology, but also excellent communication skills, empathy, and the ability to work under pressure. The future of healthcare is moving towards personalized medicine, and pharmacists must be equipped to handle evolving technologies, such as pharmacogenomics, which tailors medication plans based on genetic profiles. Continuous learning is paramount. Never stop acquiring new knowledge, as pharmacology is a fast-evolving science. My journey at Mihiraa Multi-Speciality Hospital has taught me that adaptability, interdisciplinary collaboration, and a strong ethical framework are essential qualities for success. Most importantly, understand that every decision you make affects a patient's life, so precision and diligence are non-negotiable.
That is the end of your OET listening test. Now check the answers.